Hi, welcome to the episode 3 of Osce with MUDAU ES. Today we will be doing patient identification. You must always be able to identify the procedure that you're going to do before starting. Patient identification is an approach to avoid patient misidentification for the prevention of medical errors. Tips from me: do not be the master I know it all. Don't tell yourself that you know, because you'll end up making mistakes. Critical point: know all your critical points because they determine your pass or fail. It's very, very, very important to know your ethical and legal frameworks and apply them throughout your procedures. Always make sure that before any procedure that you do, you wash your hands. Always greet your patient and introduce yourself. This is to make sure that you create respect, you gain trust, at the same time you familiarize yourself with the patient. You may do it like this: good morning ma'am, how are you? My name is Mr. MUDAU ES. I'm a student nurse or I'm a student doctor. This is my name card to show that this is me. I'm doing this in accordance with the patient's rights charter that states that any patient has a right to be nursed by a well-identified personnel. After introducing yourself, please make sure that you explain the procedure to the patient, that what are you going to do and what's the reason for you to do that. And make sure that after that you ask for your consent before you proceed. You may do it like this: ma'am, I'm here to do a procedure called patient identification. This is to make sure that no unnecessary thing is going to be done on you to avoid medical legal hazards or medical risks. Do you give me permission to continue? If the patient says yes, you may continue with the procedure. If the patient says no, unfortunately, you'll just have to stop. Assess the following things to determine the patient's needs. Ask the patient if is there anything he or she wants before you start with the procedure. Ask the patient to see if the patient is comfortable before you begin with the procedure. And immediately when done, also check the immediate environment of the patient's surrounding to make sure that it's safe and clean to do the procedure, as in accordance with the patient's right charter that states that the patient has a right to a safe and clean environment. The equipment that you will need throughout this procedure includes a scissor, which you will use to trim the edges of the belt so that you can prevent the skin irritation and to promote comfort on the patient. You will also need a bed letter, which you will use to compare or verify patient's information with what the patient is verbalizing. You will thereafter need identa belts, which includes the white identification belt, which is used to indicate the patient's admission. According to the hospital's policy, it says that all patients admitted should be identified with white identification belt from admission up until discharge. On this belt, you write the patient's name and surname, patient's registration number of the hospital, and the unit where the patient is going. According to the Regulation Act or omissions, it states that failure to identify the patients correctly will lead to disciplinary action by the South African Nursing Council. We also need a yellow identification belt, which is used to indicate any chronic condition that the patient is having, also including the allergies. We also need the pink identification belt, which is done or used to indicate the patients that they are going to do an operation or a surgical procedure. You must not forget the most important thing, which is a black pen that you are going to use to write. Please don't forget to decontaminate your hands to prevent spread of infection before you proceed. Act or Omission Regulation 767 states that failure to correctly identify the patient will lead to disciplinary action by the Nursing Council. Make sure that you verify and identify the patient correctly. Ask the patient to mention his name and surname, and also compare the name and surname verbalized by the patient to see if it corresponds with the information on the patient's file. Enter details on bands applicable as explained in the beginning. Remember, on the white identa belt we put the patient's name and surname, registration number of the patient, and the unit that the patient is supposed to go to. On the yellow identa belt, we only enter the patient's name and surname, including the chronic condition and also any allergies if available. Lastly, on the pink identa belt, we also enter the patient's name and surname, including the surgical procedure that the patient will be undergoing. Apply all required belts on the patient, making sure that on adults you apply on wrist, while on infants you apply on the leg. Reassure the patient to make sure that everything is still okay, is not too tight. Trim the edges of the belt using the scissors that you have. Make sure to also reassure the patient that you are not going to cut them, but you are just going to trim the edges of the belt. For your evaluation, make sure that you still continue to reassure the patient. Check if the identa belt is not too tight on the hand. If it's too tight, make it loose. If it cannot be loosed, cut it and replace it with a new one. After doing the procedure, make sure that you thank the patient for giving you an opportunity to do the procedure on him or her. Immediately when done, make sure that you record everything as in accordance with the principles of record keeping. Make sure that you use a black pen and make sure that you write your time and date and sign at the end. The following ethical and legal frameworks were used throughout this procedure. This includes the following. Please make sure that you know them, you master them, and you memorize them, but the main thing, you must know how to apply them. Thank you.